My name's Diana Belshaw. I'm a nurse. I work at Imperial College.
I'm Mirat Kaur, so I'm a researcher that works in an organisation called ARC Northwest London. It's the National Institute of Health Research funded programme.
And I'm Ronnie Rich, and I run FitBanker, and we coach and empower people in the area of health, fitness, leadership and adventure.
When COVID started, as a nurse, none of us knew what to expect. And then my ward closed because there was so much sickness, so they had to redeploy staff. And then I went on to the night shifts to make sure that everybody on the night shifts was being supported, because so many people were really, really scared, especially like a lot of our nurses are BAME. They were at the higher risk than, a lot of the staff. And it was really, really frightening for them. So we just had to have someone on the night shift that could be there to support them through it and just listen to their concerns, make sure they had the correct PPE and just be there for them.
I'm curious, as a frontline worker, what you were doing in those times and at the peak of it. What was the emotional support structure that you found you or your colleagues used? Was it either something provided through work, or was it leveraging family at home or your neighbours?
I've got two really, really good friends that are both nurses, so we could all bounce off of each other. So that was support emotionally. At work, on our ward, we are like one big family, so we would be there to support each other. The Trust actually put something in place with Contact. They give us wobble rooms. So you could go to the charity and say, I'd like you to set up a wobble room in my area. And it was somewhere where you could go and talk or cry, or, somewhere where you can go where it was safe and that you felt that you could let out all your emotions. Like, you see people here all the time as a nurse. But the COVID, it was just horrendous. And, you tried your best, but not everybody survived. And that is hard. Very, very hard.
I'm glad to hear that that type of support is continuing, because I think that was always the concern. I hope that you're being valued after this immediate first wave of COVID, just because I feel you've been undervalued as a profession for quite a while, and so it was a worry that are we going to put all this stuff in place and then just take it away again, because you're not getting anything else.
No, we got our claps every Thursday. No, but the Trust have been really good in that they've got Contact, and we can still have our wobble rooms and things like that. It's just us not getting pay rises or not being recognised for the work that we do. I mean, no one goes into nursing for the money, but quite a few nurses have been nominated in the Queen's Honours list this week. So there's several at Imperial and some doctors, so it's nice to get recognition.
Talking of clapping on Thursdays, we took a banner to the summit of Kilimanjaro. So thank you NHS and all the essential workers for everything you did. So globally we run leadership summits, which we had to travel to, and we had about 2/3 of the people that are committed and locked into this leadership summit happening in Tanzania, Mount Kilimanjaro, who postpone or cancel. And of course there's an impact to our business, but I think we want to strike that balance between, we stand for leadership, we stand for adventure, we stand for being fearless, and then we also want to be responsible. We want to make sure we're following legality and that safety is prioritized. And having factored all that in, putting additional process and systems in place, we went ahead. And one of the big things we did was just to really mark the times. Is we've got this lovely big banner which says thank you NHS and all essential workers, and even the airline staff, because there's been a lot of fear before we got to airports and you get on the airplane. But airline staff as well, I think are some of the unsung heroes which we don't hear much about, and I cannot have imagined more secure air travel in ever.
If you've got a good community like we've got in Hammersmith and Fulham, that does a lot to help you get through. Everybody looks after everybody else. And the staff at the hospital, I mean, we was just like one big family. We always have been. And I don't think that'll ever change. It's just, you know, everybody gets everybody through it. You know, if somebody wants to come and shout at you because they're scared or frustrated, then you take it. If they want to cry, you sit there and listen. The hardest is not being able to cuddle each other. That is hard, really, really hard.